Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we'll lift the lid on the complex worlds of neurology, neurosurgery, and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day. Hello. You're right. I was a little bit early. Okay.
Oh yeah, no worries.
Have you got somewhere we can go?
I was going to see one of the empty rooms.
Fine. Go on after
My
you.
name's Taseen Rahman. I'm an advanced pharmacist at the Walton Centre and I'm the critical care lead.
Tell me about your job. Tell me about your role here at the Walton Centre.
The core of my role is providing a clinical pharmacy service. So that means reviewing every single medicine prescribed for every patient on critical care and making sure it's the right drug for the patient, the right dose, it's being given in the right way. We factor in all the patient's pre-existing medical conditions and comorbidities, making sure the medicine doesn't interfere or interact with other medicines. That is one of the roles of a clinical pharmacist, the clinical checking side of things. The other side is the provision of medicines, and probably the thing that people most associate with a pharmacist, thought of as the gatekeepers of all the drugs. So that is part of the role as well, but the clinical side is more predominantly what we do day to day.
People who know the hospital, people who know that we have lots of different uniforms, will see a lot of people walking around in different coloured scrubs and different coloured tunics. And yours is green, and that's pharmacy, isn't it?
Yeah, so we got green, but we use green pens on critical care as well.
Oh, really? So right down to the colour coding on the notes
Exactly,
that, you know, green means pharmacy.
Yeah.
So how does pharmacy fit into an intensive care unit like the one at the Walton Centre?
The role of pharmacy has been growing in critical care over the last few years. It involves joining the consultant and the rest of the team on ward rounds. So I'll go around every morning with the consultant, the registrar, the ACCP, the sister, and contribute to decisions being made every day for each patient.
So it really is that sort of diversifying of the patient care, isn't it?
Yeah, exactly. And there are certain times when there is an individual who is best placed to prescribe a certain medicine because they're the expert. So rather than have one person being told what to prescribe, if someone is already an expert in their field, why not give them the ability to do the prescribing instead?
So that's really good then, isn't it? So rather than one person having to be a specialist in pretty much every kind of aspect of pharmacy, for example, you can have those people who, I know all about that family of drugs, or I know all about that family of clinical practice, and be able to draw on that individual knowledge.
Yeah, exactly. And that probably goes hand in hand with the MDT approach to critical care in itself. You've got respiratory physiotherapists, you've got dietitians, speech and language therapists, and all these different professions coming together and all bringing their each respective expertise, contributing to patient care. The MDT approach is definitely the way forward.
How does it feel being in such a dynamic group of people?
It's probably one of the best parts of working here, to be honest. And we all need to rely on each other as well. So I'm in discussion with each of these different professions every day about every patient. Collaborative approach is crucial.
Personally then, go back to the beginning for me. Why did you become a pharmacist?
I'd be lying to you if I told you I wanted to be a pharmacist ever since I was
You weren't a little boy going, I want to be a pharmacist when I'm older?
Absolutely not. To be honest, I never really knew what I wanted to do for a long time. I've always wanted to work in healthcare. I knew that for sure. I was good at chemistry and maths in school, and I picked those subjects in A-level. I wanted to do something in healthcare, but maybe theoretical, not so much practical. So maybe I saw myself in research or academia. Pharmacy seemed like a good fit of the use of those sciences in healthcare. I didn't really know what a pharmacist does outside of my local chemist down the road.
The one next to the GP.
Exactly. But when I did the course, I learned more about the role of a hospital pharmacist, and I saw they're not just patient-facing, but also bring specialist and clinical expertise to the table, and I thought I want to do more of that.
What was that moment where you were in your pharmacy course, or you were heading towards your pharmacy course, and you thought, oh yeah, this is exactly what I want to do?
It wasn't until during the course, to be honest. So yeah, I definitely feel for young people at that stage in their lives, because it is a major life decision you make at such an early stage. During the course, we went on some hospital placements. I think it was the second or third year. I remember shadowing as a cardiology pharmacist, and she was amazing. She was able to reel off facts about certain drugs as if they were written on the back of a hand. They seemed inconspicuous, but had such a major impact on that particular patient that I saw. Just seeing that level of expertise in the field, I thought was quite inspiring.
And sort of visualize yourself there, I guess?
Yeah, well, I never thought I'd ever reach that stage, and I still feel like I've got a while to go, probably a bit of imposter syndrome kicking in, but just being an expert in a field, I think is, it's inspiring.
And where did you do your studying? Where did you do a lot of your training?
So I went to the University of East Anglia,
Oh, right.
all the way in Norwich.
That's a fair way.
Yeah, so it's 5.5 hours by train, but I did miss home. So I'm from Liverpool originally, so nice to come back after the 4-year course. So
what was it like then? You know, obviously you qualified, you got all the things you needed to be able to come back home and do that profession. How did that feel?
Probably the biggest skill I learned was more independence and being able to live away from home, let alone the pharmacy side of things, but like doing my own laundry and cooking and things like that. But it was different because there's a different patient demographic. The one that I was used to in Norwich is very different to the one that we see in North Liverpool. But there's a huge emphasis on communication skills at our university, so that was very useful when speaking to patients for the first time when I was let loose.
The Walton Centre is a specialist neurosciences hospital. I can only imagine that doing pharmacy in such an intense section of the hospital like ICU is a very specific type of pharmacy.
Yeah. So it's very niche, definitely. So actually, this role came about as a rotational post. There was someone senior already working in neurocritical care, and I'd been recently promoted to her and was offered this as a rotation. And my initial instinct was no way. This is way too niche. I was more scared of the fact that, you know, I'm probably going to come across a bunch of highly specialist drugs I've probably never heard of before. That on top of being, you know, responsible for critically ill patients just seemed like an absolute no.
High stakes.
Yeah, very high stakes. But I had a second think, and I love problem solving. I love learning, facing unfamiliar scenarios, and I thought I'd just give it a go. So I joined, it was during the height of COVID actually in 2021.
Oh, wow.
Probably the worst time to join. So I got stuck in straight away.
Information moved really quickly. Do you find that your comms skills helped in that moment?
It was definitely a very similar scenario when it came to treatment for COVID as well. You know, 1 minute we're using a certain set of drugs and the next minute we have to use a new set of drugs. Even as we spent longer dealing with COVID, we were learning more about the disease and its management. I remember very, very early on, certain medicines weren't behaving the way we expected them to, so we were having to do monitoring for those certain medicines, things like that. So definitely keeping up to date on training and education for the ITU team was important. So we did a lot of, it was mostly verbal, given the fact that things were changing on a weekly basis. But that was definitely important in making sure we're all on the same page.
And what a trial by fire for you for taking up that rotation at such a busy, extraordinary time as well. Do you feel like things nowadays feel not as bad because you were at such an intense part of the pandemic?
I may have erased it from memory because I had to shave my beard for it. So,
yes.
But just the uncertainty, the not knowing what we're dealing with was the hardest part. And it meant that actually getting stuck in with neurocritical care was happened a few months later. So it was only, you know, maybe midway through my rotation, my 1-year rotation, that I really got stuck in with the actual neuro side of things. And that's when I really started to enjoy the rotation. I didn't mind stepping foot in the role because I knew I had an expiry date. I knew I was only here for 1 year.
Yeah.
But I ended up falling in love with the job. And when the opportunity came about to become the lead, I jumped at it. So
that's amazing.
I've been here since.
What's your biggest motivator at work then?
So I feel like because a lot of allied health professionals like pharmacists and some of the other professions working here, we're not at the forefront of people's mind when you think of care in hospitals. So, and a lot of the work we do is behind the scenes. So when you're recognised by the other practitioners here, when you're commended for your work or you've made an intervention that has made a difference to a patient, that's when I feel most motivated, to be honest.
That sort of real world feedback.
Yeah, and using your theory into practice and seeing the visual effects of that in the patient getting better because X or Y, the dose has been increased, or we've check the level for this drug, etc.
Do you feel like a bit of a detective with some of the patients that come through the door?
Absolutely. Sometimes you'll see me sat in the corner trawling through notes and bloods and things like that. But sometimes I do have to remember to take a step back and not always don't treat the number, but treat the patient. So
Absolutely.
I have to try and stop myself getting invested in all the figures and data.
That's such a good thing about being a part of a team, this team in particular. They'll always be able to support you and remind you that, the patients are at the heart of what you do, as well as all of the numbers and the facts that get you through that treatment.
Yeah, exactly. And sometimes even with the numbers being in range, in critical care in itself, those numbers can mean nothing. So important to focus on the patient and not the numbers on the page.
Are there any moments in your time at the Walton Centre that stand out to you?
There is one that comes to mind. Is quite recently, a patient was running a very, very low blood pressure, and the usual medicines we used to increase their blood pressure were not working. So we had to use an alternative, and it's quite an emergency-ish situation. The systolic blood pressure was as low as 30s, so it was just life-threatening, essentially. And if untreated, it can cause multi-organ damage just due to the lack of perfusion to those organs. We needed to act quickly. So as myself and the consultant, we were exploring other avenues because we'd use our conventional treatments for this patient. We came across a drug that we don't use very often here. In fact, we never use here, but other centres do. So it was trying to understand how this medicine would be suited for this patient, basically trying to learn everything we can about this drug as soon as possible, get it over to the unit and give it to the patient as soon as possible. And all of that happened in about an hour's time.
Gosh.
So those sorts of high pressure emergency scenarios don't happen often, but when they do, they definitely stick with you.
And what happened?
Patient recovered. We ended up giving multiple doses to the patient. They had an infusion over a couple of days, and the blood pressure picked up. They're now no longer in critical care, so that's a plus.
How did that feel?
At the time, I couldn't think of anything else apart from we need to do X, Y, and Z by 5 minutes ago. But afterwards, just the relief of getting everything sorted, making sure the patient was stable. Yeah, it was a major relief.
And then on to the next patient.
Yeah. I think, to be honest, that happened just before I left. So it's weird, but things like that usually happen on a Friday afternoon, 4 o'clock.
Sure.
There's something about that particular time. I probably went home straight afterwards, very sweaty.
Yeah.
and then tried to switch off for the weekend. So,
which can be hard, can't it? Yeah.
I try not to take work home as much as possible. Things like that do stick with you, and you always second guess yourself. Did I do the right thing? Did I give the right advice? But most of the time I make a point of switching off.
We're about to do the quickfire round. Are you ready?
Yes.
So what would you be if you weren't a pharmacist?
Ooh, I think something tech related, graphic designer or something.
What's your biggest hobby?
Badminton. I play 4 hours a week.
Crikey!
Yeah, I'm a badminton nerd. When I'm looking at the weight of a racket and the types of strings in the racket, I know I'm in too deep.
Favourite song?
Right now, I'd say Less Than Zero by The Weeknd.
Favourite book?
Disney's 365 bedtime stories for my newborn.
Oh, that's so sweet. So you're reading them bedtime stories already?
Yeah, trying to get one a day in.
How old are they?
He's 11 months old.
That's so sweet. Favourite film?
Interstellar. I like anything Christopher Nolan, but Interstellar's my favourite, I'd say.
Favourite animal?
I'm not an animal person, I'm sorry.
None of them.
None. We had rabbits growing up, so maybe rabbits, but I stayed 10 feet away, to be honest. Honestly, I'm normal. I had a fear when I was little, and it's just stuck ever since.
Food you love?
My grandma's pink prawn curry
God.
Desiccated coconut.
Ooh.
Yeah.
Like toasted or like...
No, just mixed in with the sauce.
I'm going to have to get the recipe. Food you hate?
Anything sour. I don't like sour foods, especially Bangladeshi lemons and typical Bangladeshi sour foods.
Like really zesty kind of.
Yeah.
What advice would you give to your younger self?
Ooh, that's a good question. Don't sweat the small stuff.
Best thing to happen to you?
My son. I think you'd know I'd say that.
Yeah, I knew that.
I know it's cliche, but
Who's your hero?
I would say my grandma.
Why?
She went through a lot of adversity in her life, in her childhood. She was a big part of my upbringing as well, and I've learned a lot from her, and she's probably the reason why I wanted to be in healthcare in the first place.
And finally, something very few people know about you.
So I can play piano. If I hear a song in a few, I won't say minutes, but often it's less than a minute, but I can play the song pretty quickly. So I can play by ear. I've never done music theory or anything like that, so it's literally just a case of like trial and error, pressing the keys until it sounds right.
Pharmacy in this hospital, and also generally, where do you think it's headed?
I feel like the role of a pharmacist in hospitals is being more and more recognised. I was speaking to the lead pharmacist before I came down. So she, at one point, was the sole pharmacist covering all of Walton and all of the wards here. You know, you'd get maybe 30 seconds to a minute to look at each individual patient drug chart, whereas now every ward has an allocated pharmacist to cover it.
Wow.
So not just from a clinical side, but from a managerial and a directorate side, the role of pharmacists is being more recognised. So service improvements and improvement projects change around the trust, not necessarily medicine specific.
Are we seeing the benefit of more pharmacists at the hospital?
Definitely. So the studies have shown having more pharmacists has resulted in less medication related errors, medicines savings as well. It's all part of medicines optimization, which is getting the most value out of the medicines that we do use. So pharmacists started prescribing at the Walton Centre since 2017. Although my primary role is on critical care, we, as a pharmacy team, offer a prescribing service as part of the same-day admission service.
Right.
So patients who are for elective surgery, who are eligible to come in on the morning of their surgery, will be seen by a pharmacist who will go through all of their pre-admission medicines, make sure they've complied to their pre-op instructions and stopped all the medicines they've been told to stop. And we will do the prescribing that morning for the patient before they go to theatre.
That's so thorough, isn't it?
Yeah, and we're one of a few specialties that see the patient on the morning of surgery and give the go-ahead that they can proceed for theatre.
And what's exciting you about the world of pharmacy at the moment?
So there's always new medicines in the pipeline, which is always exciting, especially in neuro, where historically we've been limited by the number of treatments and medicines available. A field of medicine that is growing is genomic medicine. Right. So where tablets and your traditional medicines are designed to work on a target population, they've maybe been tested on a group, and using that data, we assume that it's safe in the general population. Genomic medicine is all about each individual patient's genome, entire genome, and genetic sequence to provide more targeted therapies. So that's something that's already in place in oncology. When that comes into neurology, it would be groundbreaking. So
specific medication for your specific genetics.
Exactly.
To help you get better.
Yeah, so rather than taking a tablet and assuming that dose is right for you just because it's right for the average person in the population, it will be more individualized with less risks of adverse effects and better outcomes for the patient. Maybe in critical care, something interesting in the future would be AI, the use of artificial intelligence. So we already have clinical decision software, or we've got calculators and scoring tools to predict events and mortality, morbidity, length of stay, etc. But with machine learning, if we were to harness the tons of data that the nurses are collecting every hour for every patient on critical care, there's potential for AI to be able to better predict events before they happen and better predict length of stay, mortality, morbidity. Don't get me wrong, they're not going to replace the clinician at the bedside anytime soon, but they definitely have a potential to enhance care. We have so much data available to us for every patient. The nurses is recording cardiac parameters and respiratory parameters. We've got bloods, and we've got infusion data, and all of this is collected on. It's all currently handwritten by the nurse on the observation chart, but if that was all digitized and harnessed by an AI model, then yeah, the possibilities are endless.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.